For Greg Thompson, surging COVID cases have made every day a disaster.
A slow-moving mass casualty event, yes.
He runs the ambulance service for Little Rock and Central Arkansas. But his ambulances are running out of places to take patients. Computers track hospital availability. Red means they're full. It's the reddest day they've ever seen. For Dr. Cam Patterson, every day's a challenge.
We're down over 200 nurses, empty positions that we can't fill.
As chancellor of the University of Arkansas for Medical Sciences, part of his duties include overseeing Arkansas's only Level 1 trauma center. He says the latest surge is pushing his healthcare workers to the breaking point.
We've had people literally walk off the job because they couldn't take it anymore.
Somebody walking off of their shift at this hospital.
We've had people walk off their shift in the middle of a shift, as distressing as that is, because they just couldn't take it anymore.
They now have 3 COVID wards and could add more beds, but like most hospitals, can't add more staff.
Did you ever anticipate that the worst surge would be at a time when there was a vaccine?
No.
What's different this surge, healthcare workers say, is the frustration that it shouldn't be happening. Not with a vaccine, not in summer. This was supposed to be their break.
I think everyone thought that.
Instead, Arkansas's vaccination rate has remained low, and daily new COVID hospitalizations have exploded.
Overwhelmingly, most of the patients are unvaccinated. How do you not get angry?
I try to respect everyone's decision. I know there's a lot of misinformation.
Being an intensive care and emergency room physician is all Dr. Mark Vann ever wanted, or so he thought.
I just wanted to read the tweet that you put out, and you said, "Not gonna lie, this has sped up my thoughts of retiring from healthcare by a few years." What's going on?
It gave me a second thoughts on, what I'm gonna do the rest of my life.
He sees the constant stress stealing his coworkers' passion for their job and compassion for their patients.
Burnout. Do you see it? Do you hear about it?
Oh, it's constant.
As a new nurse, COVID's the only life Tequila Gardner has ever known.
I feel like it's taken over.
In 18 months, she's seen as many people die as most nurses before COVID saw in a career. And it's taking its toll.
Have you had days where you didn't want to come to work?
Yes. I've had moments where I've sit in my car and cried before I came to work. Before I came in, I've literally just sit there and cried.
Some hospitals are so desperate to find nursing staff that they are willing to pay a $25,000 signing bonus. But some medical personnel say it's not about the money, it's about their health and their mental well-being. And they say no amount of money can change that.
It has been 1 month since President Biden said this.
Today, we are closer than ever to declaring our independence from a deadly virus.
But the reality 1 month later is alarmingly different. Take a look at these maps. 1 month ago, this was the level of COVID transmission across the country. Now, watch the wave of red symbolizing high levels of transmission wash across the states. This was what it looked like 2 weeks ago. And this, just 1 week ago. And here we are today. Red washed over the majority of the country. We are nowhere near breaking away from this virus. We are, in fact, being held hostage by it. Here is how one frontline nurse put it.
We're a year into this, and people still are making the same mistakes over and over again. And it was bad enough the first time around when it was all still new and you could at least give people the excuse of ignorance, but that excuse has long since passed, and we're still fighting the same battle.
The country is nearing over 100,000 COVID cases per day. Dr. Anthony Fauci warns that could double if we don't control this outbreak. There is a critical shortage of ICU beds in COVID hotspots across the South now, pushing hospitals and medical staff to a breaking point, another breaking point. But make no mistake, the unvaccinated continue to fuel this. But there is some good news, and let's highlight it when we can see it. Vaccines are slowly ticking up. The nation is reporting more than 400,000 shots every day for nearly a week. Now, we have reporters standing by in 2 hot spots facing the worst of the surge. Let's start with CNN's Miguel Marquez. He's live in Birmingham, Alabama, the state with the lowest vaccination rate in the country. Miguel, what are you hearing from people now?
Well, look, there are a lot of people in Alabama who will never, ever get that vaccine. And that is the frustration among many people. And that's why you see that wave of red across the country, because while there is a way out of this, easy, free, and simple, 3 different vaccines, many people are refusing to get it. But now that you have cases up in places like Alabama, way up in places like Alabama, hospitalizations up in Alabama, and that Delta variant taking hold of this state, and almost every single county they are experiencing high levels of community transmission of the virus. People are getting concerned, and as the economy opens, as the masks come off, as social distancing ends, as schools get ready to go back into session, in-person session, parents, young people that we speak to, people who want to get back to life basically, are starting to opt for the vaccine. So in places like Alabama, while it's not huge, the numbers are going higher in the number of terms of number of the people who are getting vaccinated right now. So that is good news, and much of that is being driven by people who, as that economy reopens, they just figure better to be safe than sorry, get the vaccine. That Delta variant that they've heard about is just too transmissible, and they don't want to end up in the hospital. And more importantly, they don't want to end up, if they get it and they pass it on to somebody, they don't want to injure somebody even worse. Back to you.
Miguel, thank you so much. Let's go to Louisiana now. Healthcare workers there are being pushed to the edge as the number of COVID patients coming in is surging. The state just reported 2,247 COVID patients in the hospital on Wednesday, the most of any time during the entire pandemic. That is a statement of where we are. CNN's Nadia Romero is live in Baton Rouge. Nadia, what's the latest?
Well, Kate, I want to warn you, it's bad, terrible all across the state of Louisiana. Let's talk about one healthcare system, the largest one in the state. What we're seeing is some 900 people who are hospitalized in this one system. Out of them, 90% are unvaccinated. That's a 73% increase in hospitalizations compared to just last week. And when you look at those numbers, we know that it is the Delta variant that is spreading so quickly. At one location, they've already had to turn away 300 people in just 10 days. Listen to the president of that health system talk about how things are only going to get worse.
This is going to keep escalating. We think it will escalate in the next, several weeks. So it is absolutely reaching a critical situation.
So here we are at Our Lady of the Lake Hospital. This is the largest standalone hospital in the state of Louisiana here in Baton Rouge. They have about 174 people between here and the Children's Hospital across the street that are hospitalized. So down one patient from yesterday, but there's no relief for the staff here. They discharged people, but they admitted another 21 patients in just 24 hours. And they're seeing their numbers continue to go up. They've run out of beds. They're running out of room. In the ICU, people are only getting sicker. Yesterday, 61 people in the ICU. Today, 67. When you look at those numbers, you know they're bad, but it doesn't take a mathematician or a science whiz to figure this out. The states with the highest COVID cases have the lowest vaccination rates.